President Trump is repeating his call for pregnant women and now young children to avoid using Tylenol. In a post on Truth Social Friday, the president took aim at the popular pain medication, and he urged parents to split up the measles, mumps, rubella vaccine into separate shots, along with other vaccine advice that runs contrary to medical societies and guidance from the Centers for Disease Control. At a news conference on Monday with Health and Human Services Secretary Robert F. Kennedy Jr., the president linked childhood autism to the use of acetaminophen, the active ingredient in Tylenol, by pregnant women. Here to help us understand all of this is Dr. David Agus. He's a CBS News medical contributor and the founding CEO of the Ellison Medical Institute, founded along with Larry Ellison, part owner of Paramount, our parent company, Skydance. David, good morning. And what should we make of all of this? There was a lot of information out there.
You know, I think our president in his mind means well, and he's saying what he believes. The problem is that we need real data to make decisions for our children. And the data show the current ways of giving vaccines work and are remarkably safe. So parents should go by what the CDC has recommended and is still recommending for their schedule. You know, when a child is born, he or she are exposed to thousands of things in nature, and you make immune responses. We give a couple dozen extra because if you're exposed to those, you can get really sick, and that's what vaccines are.
And what do they say? Babies are like sponges. They pick up everything around them because they're always touching everything. Let's switch gears and talk about flu season coming up. The CDC says this season could be just as bad as last year as far as hospitalizations. So who should get the flu shot? What do you recommend? Bring us some clarity on that as well.
All right, so last year there were 50 to 80 million cases of flu in the United States. Pretty big number, a million hospitalizations and probably 50 to 75,000 deaths. Everybody should get a flu shot.
Everyone.
Everyone should get a flu shot. And, you know, the reasons are several. One is, you know, hopefully it stops the flu, or if you do get the flu, it'll be much, much lower sickness. But what the flu shot does, and this is the coolest thing in the world, is it actually has been shown to lower cognitive decline, to decrease cognitive decline as you get older. Wow. So actually, you retain brain function, number one. Number two is getting the flu increases risk later in life of heart disease and cancer. So you get these benefits, blocking the flu, decreasing brain decline as you get older, benefit in heart disease, benefit in cancer, and I don't know a downside.
You talk about the flu, to combat it, there's some interesting ways that are now on the shelf for us, aren't there?
Yeah, so if you still get the flu, because you skipped the shot, because you didn't listen to us,
right now, right.
Which a lot of people don't listen to us, then there is a pill. It's a one-shot deal, one pill called Zofluza.
For the whole season?
Take that one pill when you're either exposed. If your husband has flu, you take that pill, you won't get it. Or if you have it, it will temper it down dramatically. Tamiflu used to be 5 or 10 days.
Right.
This is one pill once. So very easy, no excuse not to treat it if you've been exposed or you have it.
By the way, that's me. I always hear people sniffling and sneezing, and then I'm like, okay, I should have taken something, so maybe I should consider this. How can people get this, though? Because this sounds new. I've not heard of this before.
It's about 2 years old, and there's this new thing called a prescription. It's kind of cool. Yeah.
The script.
It requires your doctor to do the script. And so what normally happens is if I test somebody in my clinic positive, I'll say, hey, what's going on with your family? I'll send scripts in for them so they don't get the flu also.
And what about side effects, though? Because is this all good? It's not going to make me drowsy? It's not going to impact my fitness?
It will not make you drowsy, and there are, no real side effects to it, which is good.
Awesome.
Safe and good. I mean, the key is just stay on top of these. There's a lot of noise out there. Get that flu shot, vaccinate your kids, do the right thing.
And obviously, COVID, pneumonia.
COVID. I just got my booster. It wasn't fun, believe me, but I don't want to get very sick with COVID, which we're all going to get.
Yeah, there's so many
David
vaccines.
Agus with all the news we need. So great to have you back here to see you again.
I keep thinking, kids are sponges. That's my
They pick
takeaway.
it all up. Good to see you.
You too.